and welcome to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy, and thank you very much for joining us. The first week of May is recognized as Mental Health Week. This year, particularly, issues of mental health are impacting a lot of people. Here to speak about the concerns and the helps that are available for people is the Chief Executive Officer of the Canadian Mental Health Association of the York Region and South Simcoe, Rebecca Shields. Rebecca, thank you very much for joining us today. Thank you for taking the time and coming out.
Thank you so much. It's such a pleasure to speak to you and to the community.
Before we get into the issues of mental health connecting to the pandemic, I'd like to try to get an understanding of mental health generally. When we use the term mental health, what do we mean? What is a mental health issue? And how would you describe the condition of good mental health?
That's a lot of questions, and It's one that we get asked a lot. And I think people are curious. So first of all, the first thing we have to know is that mental health is health. Our brains are part of our bodies, and we are interconnected. And so I often say to people, when you're really stressed, don't you feel like there's pain? Or, if you're depressed, like we often feel mental health physically in other parts of our body. It makes us tired. If we're not feeling well, we can feel irritable. But what actually is it? So first of all, mental health can feel like ongoing stress, and all of a sudden you don't feel like yourself anymore. So what does that mean? Maybe you're not sleeping, you can't fall asleep at night, or you're waking up in the middle of the night and you're worried. Depression can feel like a sense of hopelessness, like it's never going to get better. Chronic loneliness can feel like nobody's ever going to like you again. But mental illness and other forms become even worse. So when we have somebody who has schizophrenia, for example, we often hear about psychotic disorders where people imagine things in their brain and it's real to them. So they hear voices, or they have illusions in their brain, or they're agitated. And there's nothing physically wrong with it. They just can't stop. If you have bipolar disorder, for example, one day your brain has all of these hormones and chemicals that are filling it up, and you feel like you are the king of the world and you can do anything and you're a master person. And then all of a sudden your brain switches the hormones that are in your brain and the chemicals, and you feel like you're worthless and that you should probably die because there's no hope for you. And it can happen in a short span of time, because ultimately it is brain health. And mental illness is when our brain health isn't any good anymore. And our brain health affects our behavior. And like other types of illnesses, like diabetes, our behavior can affect our brain health. So when you have diabetes and you eat a good diet and you can manage your blood sugar levels, you can feel healthy. But if you're a diabetic and you eat that, that candy or that ice cream, and you don't manage your blood sugar levels, you can go into a diabetic shock. So it's about managing our mental well-being. And for some people with mental illness, we don't know why. We know that 1.6% of the population has schizophrenia, and we don't know why. And it doesn't matter if you live in Canada, in Africa, in Europe, in Australia, that stat is global. So it's not somebody's fault. It doesn't matter if you're rich or poor. But what we do know is that the most common mental illnesses, like anxiety and depression, really can be impacted by our environment. And I think our talk today, and when we talk about the pandemic, we're going to talk a lot about the impact of ongoing stress and difficulty and how that impacts our mental health and our well-being.
So I'm hearing you talking about making a distinction between actual diseases characteristic of a mental illness and other factors that affect your overall well-being that could lead to a mental illness.
There's a great analogy, Dave, that somebody shared with me very early on in my career, and it said that all of us, if you imagine a mason jar or like a jam jar, a glass jar, and if you think about that as your brain or your mental health brain, imagine that if you have a genetic predisposition, you have a ball in that jar, or other factors that may have a ball in that jar. And that jar is our mental wellness jar. And so you might have a big factors like a big ball in that jar, or you may have gone to war, had a very stressful incident, and you have PTSD and you have another big ball in that jar. Or you may have every day you're in a situation at work where you're undergoing tremendous stress, and a little ball goes into that jar, and a little ball goes into that. And once that jar fills up and it starts overflowing, you go into mental well-being, into not coping anymore. So we can understand that some people just have something in that jar that's so big that they need support, medical support and intervention right away. And some people have that jar, and we can work on both medication and therapy to help people either keep the balls from coming in the jar, or we can help them remove the balls so that they can balance their mental well-being. So when we think about mental illness, and we know what the symptoms are, we know that depression, the symptoms can be hopelessness, and the hopelessness can lead to risks of suicide. And it can lead to not being able to get up in the morning. One day, I've met so many people, so many gentlemen that will say to me, I was going to work, I was doing a thing, and then one day I just couldn't get myself out of bed, and I don't know why. Like what, I used to be this guy. And sometimes it comes on because maybe they've had a heart attack, and all of a sudden they're not themselves. And all of a sudden they realize, because our brains and bodies are connected. So they go from this place of mental well-being into mental illness. And in mental illness, that's when people like the Canadian Mental Health Association and our community partners are there to support people, because sometimes we need to help people treat the symptoms and also rebuild those skills to have mental wellness. Just like if you have cancer, the doctors can remove that, but they've got to, get your energy up. Or if you've broken a leg, you need to go to rehab. It's the same thing. We do rehab for people for recovery. It's the same. Mental illness is just a health issue. Everybody has it. Everybody untreated. I always say to think about mental health as getting a cold. So you get a cold and you ignore it because you think, it's just a cold. And then you're coughing, not COVID, but you're coughing, and you think, this isn't usual. But then you're thinking, I'm just, because we have stigma, and we'll talk about that, I don't get support, right? And then it grows because it's like an illness. It still gets worse. And next thing you know, you have pneumonia. Then you have bronchitis, and then you're in a huge problem. Same thing with mental health. If we can detect early, then we can treat people and know that, those first signs of, gee, I'm not myself today. This is going on too long. I haven't been sleeping now for like more than a week, more than 2 weeks. I'm yelling at my kids. All of those, I'm drinking too much. I'm binge drinking. I just feel like, all of those things can be signs. And instead of saying, I just have to tough it out, maybe it's time to say, gee, like my mental health isn't where it needs to be, and maybe I need to get some help.
Yeah, I think those are some great metaphors that you bring in there to give the image of it. But you did mention the issue of stigma, and I can see people avoiding getting help for a couple reasons. One is, as you say, that dismissal. Well, this is a minor thing. I'll overcome it. I'll get out of it. But the other area seems to be the stigma that's still associated with mental health. Am I correct? And what's being done to remove the stigma?
Well, I want to say we've had great strides in the last, 10 to 15 years. And, we all talk about the Bell Let's Talk campaign, bringing awareness, having people talk about it, and knowing how common it is. And in fact, we used to say that at any given time, it depends on what you want to say, 1 in 4, 1 in 5 people will experience a mental health issue. We now know that by the time you've gone through your life, you're going to have experienced some form of mental illness. It just happens because we're going to go through grief and loss.
Let's just get that. What was that number again? How many people?
So we always say at any given time, we say that 1 in 4 or 1 in 5 Canadians will be experiencing a mental health issue. But what we know now is by the time we live our lives, all of us are going to go through a mental health issue. All of us will have some sort of impact, whether it's from grief and loss, and most of us will recover. Now, some people, as I said, will have very significant mental illnesses, schizophrenia, those ones, and those complex care, we need really specialized support. So we need to make sure that those people have the healthcare that any other healthcare needs. But all of us have a mental health journey, just like all of us get colds. All of us experience health. Mental health is health, and it's very, very normal. And here's the good news. Most of us that have anxiety or stressful periods and all that stuff, we get a little bit of help and we recover. Like the rates of recovery for depression with early intervention treatments are over 80%. So that's great. When we don't treat it, and it goes on and on and on because of that stigma that we're going to talk more about, that's when it can escalate, because mental illness is like any other illness. It has a trajectory. And so that's why it's so important. That's why we invest in youth. That's why I invest, because we know if we can identify it early and we can provide support early, we have the best chance of recovery. No different than early detection of cancer. So that's really important. And stigma, you asked, the stigma issue live, well, it is, but it's getting better and people are talking about it. And the one thing about this pandemic is we've all been talking about how stressful and how this is impacting us. So we're having those conversations, and the difference is we need to have those conversations. And when we feel that, you know what, this is just going on too long, we need to then take that leap of reaching out for support. Or if we see our loved one saying, you know what, you haven't been yourself for a while, let's reach out and get support. And that's the difference. So now we're talking about it. Now we got to get help when we need it.
I do want to get into talking about the effects of the pandemic, but just before we do, maybe if you can explain, what is the Canadian Mental Health Association and what are the objectives of the organization? Who are you?
So that's a great question. So here in York Region South Simcoe, we're your community mental health provider, and there's others, but we provide a whole range of supports and services. So we have interdisciplinary teams, which include psychiatrists and nurses and social workers to help people with those severe mental illnesses live well and stay healthy in their community. We have a whole range of services for people who are struggling that need more case management support. So they're learning important skills around managing their symptoms and being able to return to work, being able to return to their families. We have a whole range of services for people who are in recovery. So really, again, that it's basically rehab. So in fact, we have over 30 programs, and we have a huge program called Bounce Back, which we'll talk about later, for people who are experiencing that stress and anxiety, that we can deliver clinical care over the phone. So a range of therapeutic, clinical and non-medical services to really support people with our partners. We work in partnership with our hospitals and other providers to really, our job, I always say, is twofold. One, to keep people well, and two, if somebody has had a mental illness, to help them recover in their community, because nobody wants to be in the hospital.
And that's where your funding is primarily based, is from the provincial government through the health department?
Right. So CMHAs are all across Canada, but each of us are our own sort of unique organization. We're grassroots. We kind of design our services around the community, and then we're an association. So we learn and share from each other, but we're federated, not global funding. So we are funded through Ontario Health, or the Ministry of Health and Long-Term Care, to provide that clinical services to our community. But we also have other funding partners to provide specialized care. So we work with the Region of York around some of our homelessness programs. We work with Citizenship Canada in order to provide mental health care for our newcomer refugee population. And we receive funding from the United Way for some of our great youth and family programs. So we have lots of funding partners, and of course, our amazing donors that keep our mobile health clinic called Mobies for Youth on the road, because those donors make such a difference in ensuring that there's healthcare for youth. So between our great donors and our major government providers, we're funded to be there for the community. And to just give you an idea, we're a staff of about 350 interdisciplinary people whose sole purpose is to support the mental well-being of our community.
And just before we go to break, I want to ask you, what is your own background, Rebecca?
Oh my gosh, I've been in the social profit sector for my whole career. I started my career off in Vancouver, and I was in Vancouver's downtown east side. So had a different lens on working with people who were dealing with substance abuse issues and homelessness and poverty. I worked with Indigenous youth organizations at the time in Vancouver Native Health, but I also worked with many organizations in community living and other things. So a wonderful prolific career.
Well, big background in your experience. We're going to talk about the effects of the pandemic after the break. Stay with us on Politically Speaking. Welcome back to Politically Speaking, Insights and Issues. We're talking about mental health with the CEO of the Canadian Mental Health Association for York Region and South Simcoe, Rebecca Shields. Rebecca, the latest polling data that was commissioned by the Canadian Mental Health Association shows that only a third of Ontarians consider their current state of mental health as good or excellent. What does your analysis of the data say about the reasons Ontarians consider their mental health declining?
Now, it's really important that we look at the pandemic and the polling that CMHA Ontario has done with Polaris over the 3 waves of the pandemic. So we did our first poll back in May 2020. We did another one in August 2020, and we just completed one in March 2021. And what we're seeing is, of course, that more consistently, people are reporting that they are seeing a decline in their mental health. So, last summer, in fact, at the beginning of the pandemic, over 50% of Ontarians said, my mental health, I feel like I have good mental health. And then it went down to 48% last summer, and now it's at 35%. And, 80% of Ontarians believe that their mental health is going to be worse off after the pandemic. And most of it is around the experience of stress and high stress and increasingly feeling that anxiety. And in fact, what we've seen is even an increase in the levels of depression. So before, in last spring, we had 13% of the population felt depressed, and now it's creeping up to 17%. And when you look at hundreds of thousands and millions, you start to see that those are very worrying numbers. So the question is, what is that telling us? Well, it's telling us a couple of things. We know that there are things that increase our anxiety. So of course, the pandemic, there's so much uncertainty. We have uncertainty around, whether or not our own fears of health. Am I going to get it? These new variants, what does this mean? We've had uncertainty around the vaccines. Am I going to get a vaccine? Am I not going to vaccine? Is the vaccine going to be safe? Is it not going to be safe? We have uncertainty around, are we going to be in another lockdown? But we also see that the impacts of the pandemic are disproportionately affecting certain populations over others. And in fact, women are reporting higher level of anxiety than men. In fact, women are reporting anxiety levels at 23.4%. So almost 1 in 4 women are reporting higher levels of anxiety compared to 1 in 5 men, especially women with children and family with children. And it makes sense. I have young children and I worry, they don't like online learning. It's very stressful. We're in the home. I can't send them to camp. What's going to happen? So that feeling of uncertainty drives stress. So what is stress? Stress is part of our natural response to that fight, flight, or natural response to fear is the fight, flight, or freeze response. Right? And so that's natural. Our human beings were built that way in order to survive. That's how our human species has evolved. So now we're in this constant state of uncertainty. So our body is constantly shooting cortisol up into our brains, and we're not able to let it go. So maybe most of your listeners, maybe they've been in a car accident or a really fighting situation. They just, they come alive. And then over time you feel like, okay, I'm coming down. Well, we're in this constant state of that. And so our brain is kind of constantly in this motion of anxiety. And if we don't have good responses, we start to cycle. And when I talked about that losing sleep, and I talked about that can't stop my thinking, all of that really contributes to that sense of unease. And then what happens is because our brains are so super smart and efficient, we stay there instead of coming down. So let me explain that a little bit further. Some people will know that the first time that they learn something, it's really slow and cumbersome. Maybe you've learned how to play piano or learned a new language, or you're learning how to build a deck. It's a very challenging. But once you get good at it, you're really fast. And in fact, once you learn one language, it's quite easy to learn a second language because your brain has developed those pathways. Similar, here's your brain responding to high levels of stress, and it's getting really good at it. So all of a sudden you find yourself, you're worrying not just a little bit, you're worrying all the time. And all of that anxiety is causing now physical effects on your body. Remember how I talked about the physical and the mental connection,
Of course, yeah.
and you don't feel like you can eat, or you're eating too much, or you're experiencing pain or worry or headaches. These can all be physical symptoms of this ongoing stress and anxiety and worry. And then you're worried about your worry. So that's what we're talking about. And, and then your sleep is ruined, and then you're irritable, and then you can't concentrate. So you can see how you're going from a place of mental well-being into a place of mental illness and not well-being. Here's the good news. The good news is that's totally treatable. We can help that. And in fact, CMHA has a great free program delivered over the phone called Bounce Back. You can Google bouncebackontario.ca and you can self-refer. Here's a great program that actually supports you and with a clinician and a coach to manage your anxiety and manage these feelings that come along. And we actually have some specific stuff around managing the pandemic anxiety, because the pandemic is keeping us in this state of uncertainty, and uncertainty is a state of unsafety, and unsafety is fear, and fear is stress. Does that make sense?
Absolutely, absolutely. Yeah. One of the thoughts that are in my mind, maybe it's on my mind right now, particularly because I was just asked to help put together some resources or list of resources for seniors, particularly living alone.
Sure.
I have a suspicion that loneliness is really entering into that aspect among seniors more than other segments of the population as they try to deal with their sense of isolation. Is that something that the data supports then?
Well, actually, what's really interesting, Dave, is that what we're actually seeing is that 18 to 39-year-olds are actually experiencing greater increases in the experience of chronic loneliness and loneliness. And you can imagine that. I'm a young person, I'm living alone, and now I can't see my parents. So their whole life has changed. Their social networks with their friends, I can't go out. Where our seniors, certainly they're feeling more isolated and they may be in the communities, but their lives tend to be more stable. So their rates of loneliness, which were high due to, transitions or loss or grief, that rate in terms of our society is remains somewhat level, whereas the experience of loneliness and the stress of loneliness, and it's important, I think, for your listeners to have a moment to talk about loneliness, because at CMHA, York Region South Simcoe, we're really looking at how do we eradicate chronic loneliness. Human beings, and we talked about the stress response, but human beings actually require connection for survival. So this is how, again, when I talk about how humans are formed and how our species survived, much like water and food, connection is important for our survival. If we don't have it as human beings, we can't survive. So if you need water and you don't get it, you dehydrate and your body decompensates. If you need food and you don't eat, you get malnourished, your body decompensates. We know now, the science and the data is that if you don't have connection where you feel valued and belonging, it's so stressful for your survival that your body decompensates. In fact, it's equivalent to smoking 15 cigarettes a day. Chronic loneliness is one of our huge healthcare drivers. We know that for seniors that are lonely or experience chronic loneliness, they're more likely to end up in hospital and stay in hospital. Mm-hmm. We know that all of us will experience episodic loneliness. We might go to university and transition to friends, move to a different town. But those high-risk populations like our seniors, university students who are going away from home, newcomers well-being, that experience of losing connection and community and ongoing loneliness, that's where we have high levels of, it actually results in high levels of depression and suicide. It reports on high levels of substance use and abuse, binge drinking. So all of that stuff that we'll talk about. So social isolation is different than the feeling of chronic loneliness, because you can be socially isolated and not feel lonely. Or you can feel lonely and not be socially isolated. But we know with the pandemic, the intersectionality and us all feeling that we can't connect and hug and love the ones we care about is causing great stress. And the longer it continues, it's tipping from that episodic loneliness into chronic loneliness for populations. And those coping mechanisms that people have can be really challenging. So if your coping mechanism is not able to reaching out to people and connecting, and it's, binge drinking or drinking too much or smoking cannabis, all of a sudden those behaviors can actually exacerbate and cause more long-term problems that we want to sort of support and deal with.
Yeah, I believe your study showed a disturbing statistic that saw an increase in the number of Ontarians abusing different substances. More than a quarter of Ontarians now have taken up coping using hard drugs or other drugs.
So a lot of that data, we have to sort of break that out. So a lot of it is when we look at alcohol use, or cannabis use. Let's look at cannabis use. Of the people who use cannabis, over 50% say they're using way more than they ever have before. So more people are trying, but those who are using it are using a lot more. The same thing with alcohol. Those who are drinking a lot more, and binge drinking has gone up a lot. And some of the things that it's just about coping. People are stressed, and of course, alcohol is a drug. It's a depressant. It brings your body down. So those things, but they're not good in the long term, because we know that both of them are addictive substances, and both of them can lead from coping to not coping. Right. So, and they can result in dangerous behaviors that are associated with them. So we want to be really, really careful about having that glass of wine, not that bottle of wine. Right. So we have to, we're not here to say don't drink at all, but how do we manage, and how do we understand maybe we need some better, more positive health strategies to manage that stress and anxiety? And then what can we do to begin to manage that, and not just drink a bottle of wine so I can go to sleep at night? What else can I do that's going to promote my mental health and actually help me in the long run, so I can have good health, good relationships, and good coping?
Well, let's get into that in the next section. But I do want to ask you one report I saw from the Mental Health Research of Canada. David Szollosy, who's a board member there, talked about the depression rates, and he's predicting that the depression rates will outlast the pandemic, and that those issues are going to be here with us for a long time as a consequence. Why is he making that kind of prediction, and is that what your data is anticipating?
So there's some really interesting data that's come out of previous pandemics that we have looked at. So we looked at some of the data around SARS and what happened particularly to frontline workers and essential workers. And we have lots, right? We have lots of people that are working, whether it's at our wonderful hospital or paramedics, but also our cashiers and at our grocery stores and our delivery people and our manufacturing and our food plants, like all those people. What we've looked at is, but after 2.5 years, almost like the rates of depression were up by over 40 to 50%. Why is that? Because again, they've been under stressed. That movement of all of those hormones and chemicals have moved into feelings of hopelessness. It's not going to get better. It's a trauma. Many people are experiencing this as a trauma, and so they move into depression, and those are common outcomes if we don't get treatment and support. So very real, and we're already planning, like, how do we provide resources today to support people and educate people today so that we can prevent this, what we call the fourth wave of the pandemic, which is the mental health wave, and make sure there's resources in place so that those people reach out early before it becomes too late.
The availability of the vaccine rollout is not appearing to have any effect on Canadians' depression and anxiety rates. One would have anticipated that there'd be a sense of relief now that the end is in sight. Why are we not seeing a decline then as a consequence of that event? So
this is Rebecca's opinion. And my opinion around that is that it's that uncertainty. That news is not in isolation of new variants that are coming out of foreign countries and travel that's coming in. There's uncertainty around the vaccine. There's vaccine hesitancy for certain populations. So all of those uncertainties continue and unknowns are increasing our levels of stress. I've gotten vaccinated. We encourage everybody to get vaccinated, but At the same time, we know that not everybody has reached that point, and maybe when we do and we start seeing the impact and the reducing rates of COVID, we'll all start to breathe a sigh of relief.
Okay, and when we come back from break, I'm going to ask you what other kind of supports are available. Stay with us on Politically Speaking. Welcome back to Politically Speaking, Insights and Issues. I'm speaking with Canadian Mental Health Association CEO for York Region, Rebecca Shields. Can I ask you now specifically about the services and programs that you offer at the Canadian Mental Health Association, York Region South Simcoe? What is available for people to access?
So we have a host of programs and services, and so do our partners in the community. So I want to start off right off at the bat to let people know, if you're hearing this and you're in crisis, I want you to call 310-COPE, because that's the crisis line for crisis support. So if you're feeling like you're really stretched, and even though they say the emergency departments are backed up, if you feel like you're in crisis, please head to your emergency department.
Okay, and that number, hopefully we're going to have even that on the screen now too.
Yeah, it's just call 310-COPE. and that's our regional crisis support line, and all of us are involved and we'll get you the help that you need. However, there's lots of people that need support, but they don't feel like they're in crisis, but they're realizing that they just need a little bit of help to move on. So let's take the next step. First of all, I want you to know that we have implemented a call service. So this isn't crisis. So this is Monday to Friday. You can call us and get online counseling for whatever you need. So you just call our number 1-866-345-0183. You just call that number, and we have clinicians and social workers available to help you with what you need. And we've done a range of stuff. Sometimes we're doing a little bit of counseling. Other people have needed help getting some forms. Other people want navigation and support, like, what do I do? Just know that you can call us, and we're going to have somebody to speak to you. But some people are trying to manage what I talked about, the bounce back programs. Let's talk about that again. Some people are trying to manage that stress and anxiety. All of these programs I'm talking about are free. They come at no cost, and they're provided by our wonderful government. So the Bounce Back program is available to help you manage it. It's evidence-based clinical therapy, cognitive behavior therapy to help you manage your anxiety, worry, mood, and stress. And it's self-directed, so you can just self-refer yourself, and you can work with a coach or a clinician over the phone, and they'll work with you around supporting you to develop those techniques to manage your worry. We all learn how to exercise. We all learn how to cook and eat healthy foods. This is actually learning how to manage worry and anxiety. And this isn't stuff we were necessarily taught in school, but this is evidence-based techniques, and it works. So again, bouncebackontario.ca, just Google it, and you can self-refer into the program. And we have a whole model of care that's there to help people. There are also a range of other supports and services that the Canadian Mental Health Association and our partners like Addiction Services of York Region or York Support Services Network offering collaboration. You can call any of us or call Streamline Access and get those supports and services. So we might have something for you if you've lost your job. We have employment supports. If you need housing supports, we have a whole supportive house and a housing program. You can also call 211, the Region of York, and of course they're there for housing support. So know that one of the big differences the pandemic has made is it's brought us all together to work much more collaboratively, because we're really trying to help people manage all of the components, because we know that there has been job loss because of the pandemic. So we're really working together around food security, around vaccine rollout, around all that stuff. But again, if you need mental health supports, and as I said, if you're starting to think, I just haven't been myself and it's been going on a while, don't wait. Don't let that cough go into bronchitis. Don't let that anxiety and worry go into a long-term issue. We're here to help, and we can help, and we will.
So I just want to be clear too of what you're saying about the accessibility to the services, because if someone needs long-term therapy or sees a need for that, that's the kind of accompaniment or assistance they need in dealing with health problems. Is there an obstacle created by affordability? Is mental health, ongoing mental health, something that's only available to financially secure people, and those without union jobs or unemployed or working precarious work? Do they have as much access to that kind of support if necessary?
Look, Dave, I'm going to be the first one to tell you that there has been underinvestment in mental health for decades and decades and decades. And we have a provincial campaign called Everything Is Not Okay. We're trying to advocate and push our provincial government for more investment to keep up with the demand. So it's true that the system has already been buckling, and we've heard lots of issues around wait lists and access and problems navigating. So all of us agree that there isn't enough. But what we are trying to do is make sure that when people call, there's somebody to answer the phone and we can get you started on a mental health journey. And even with the Bounce Back program, what can we give you today so that you're not languishing for a long time? And depending on the level of care you need, how do we address that? There are absolutely gaps in the system. There are, particularly the gaps are for people with those complex mental health and addictions issues. Those folks, particularly during the pandemic, those folks that are dealing with high levels of complexity, schizophrenia, schizoaffective disorders, psychotic disorders, complex concurrent disorders, major depression, those folks are even more at risk because many of the services and supports that they relied on were stopped or prevented during the pandemic, and we've ramped them up and we're providing them in a virtual way. But for some people, virtual isn't the preferred mode of access. So for some people, their social groups have been cut back and they needed those to rely on. For some people, as we know, opioid deaths have been skyrocketing because they don't have access to supports and services, or they're using alone, or they're not coping well. So I'm the first one to tell you that we need investment in this province. We need more access to crisis support services. We need it easier for people to navigate, and we need supports and services that are also culturally relevant and culturally competent. So some populations might feel that their needs are not being met because the services have been designed for Canadians who have been living here for generations and not for their unique needs, which is why we started a partnership with the Welcome Centers called our Newcomer Wellbeing Program, so we could specifically address their issues and what it's like during the immigration and the refugee process. So there's a lot to be done, but I don't want this idea for your listeners to say, oh my God, I'm just going to get there and have to wait. We're doing everything we can to provide immediate access to at least short-term supports and then connect people to ongoing care. And it's more important to reach out today than to wait and think that you can just tough it out. The system is there, and we are doing our best, and we need more people to donate and support us so that we can help grow. But at the same time, it's really important that if you're feeling like you're not yourself, that to reach out and at least start your mental health journey.
So you are talking a lot of aspects of public policy that should be put in place to assist people with mental health issues. Have we seen any particular supports increase during the COVID-19 pandemic? Any increase in support services for mental health issues?
Sure. We had some wonderful investment to increase the access to the Bounce Back program. So right away, because again, that's delivered over the phone, it's evidence-based, it's clinically proven, we ramped that up so that people could have immediate access to that for stress, worry, and anxiety. We have also seen investments from the provincial government around withdrawal management services, around supportive housing services. We also saw some critical investments around our homeless population, ensuring that they were getting into housing, hoteling, things like that, so that they would be protected from the virus and also not be in congregate care settings. So we've done a lot of work around that in order to protect those that are most vulnerable. There is more investments that were done in order to improve access. So we did improve we have done some investments improving access, particularly for frontline healthcare workers. We know that many of those nurses and long-term care home staff were absolutely traumatized by the impact of the pandemic, and that's a PTSD response. And so we have providing access to care and support for them, because that PTSD, as we talked about in the previous advent, can end up being a long-term depression, and long-term depression can lead to a whole series of consequences, including and at risk of suicide. So we ramped up some specific care to address what they went through and help them deal and cope with that experience. And we need more. So we need more because that is ongoing.
I want to ask you now, you've made allusions to this through our conversation today. But specifically, can you summarize some recommendations as to how people should deal with the stress they are experiencing? And what can each person do to improve their mental health?
Thanks for that question. So I always say a few things. First of all, each person is unique. And I want to really honor that all of us have our own ways. So here it is, though. My top ones that I always say is, first of all, let's look at sleep. Sleep is the most critical. If you're not sleeping, it just triggers a whole host of problems. Make sure you have good sleep hygiene. So don't be on your phone all night. All those things that we say to people, try to get to bed. Don't drink right before you go to sleep, because alcohol can wake you up later on the night. Really focus in on how do you get a good night's sleep, whatever that looks like for you. Make sure you're eating well. And if you are drinking or use in moderation. Think about that. We all talk about walks and the value of physical exercise, but I'm just going to say this: get out in nature. We know that being in green spaces, look, you're up in the beautiful, beautiful region of Georgina, amazing parks and forests and trails. That's what we can do right now. So use them. It's spring. Get out there and enjoy. The other part, I want you to think about connecting to family and friends. It's sometimes when we are socially isolated, it just feels like one more Zoom call or one more call and you're tired. But know that it's going to be as meaningful for that person as it is for you. So do your best to reach out and connect to people. Make sure you've got those social connections. And my last one that I often recommend, which is our own coping, is, take news holidays, take news breaks, focus in on families and other things that you can control. Stay in the moment. People love mindfulness, meditation, things that keep you in the moment so that you can have a gratitude practice for the things that you have today. Gratitude is actually one of the greatest gifts that we can give ourselves. When we are thankful for what we have, we don't worry about what we don't have. And so whether you're using a gratitude journal or other ways, put it down on paper and then allow yourself to really live in that moment. Gratitude for your friends and family. That's the source of well-being. All of those things that I talked about are the source of well-being, which are really the antidote and part of the recovery from unwellness, right? So that's where we want to go.
I know when you talked about the forests, we are extremely fortunate in this part of the world to have so many trails through the York Region Forest, Provincial Park, etc. I know for myself, even yesterday, walking through the woods is rejuvenating to such a high degree. What about things like we also hear mindfulness exercises, yoga, those kind of techniques? What do you feel about those?
I am a practitioner myself, so I'm biased. I meditate. I use an app, a free app off the internet, and just 10 minutes a day can do wonders. It's taking that space to get into the moment, right? It's to stop that worrying. So I'm a huge practitioner. Some people mindfully meditate as they walk in the forest. So there's lots of ways that you can do it. And again, those are free apps that you can get on your phone. Yoga and stretching and exercise, all of those, whatever it is that you enjoy, whether it's going on a bike ride or yoga, it's so important. We know absolutely mental health is health. So we focus in on our physical health, good sleep, healthy eating, exercise, all those things we know are health promotion. They're mental health promotion as much as their physical health promotion, because there's no difference. We are a whole being and a whole body. So if we focus in on that stuff and then our connections and belonging to our community, that's really going to be the key to our well-being and to get through this pandemic together.
And again, if people are feeling that situations are getting beyond their control, we do have the COPE line for them to phone, and that's a free service.
Yes.
Okay, we're going to end up this segment now and come back just to summarize. I've got a couple more questions to talk to Rebecca Shields about. Stay with us here on Politically Speaking, Insights and Issues. Welcome back to Politically Speaking, Insights and Issues. I'm Dave Szollosy, and we're talking about mental health. And Rebecca, I'd like to ask you a question that's very often posed by people who are caught in a situation, not so much necessarily of their own mental health, but someone in their family or a close friend who they suspect is affected by mental health difficulties, and they're not dealing with it. If I see that, if I'm living with that, what can I do?
You know, this is a question that we get asked all the time. You know, when I see somebody I love, and sometimes we can feel really powerless because they're not getting help. So there's always things that I tell people. First of all, you always have to take care of your own mental health first. You always have to, you know, if you're well, then you can deal with somebody else, right? So first of all, take a breath and just focus in on, how am I doing? Am I okay? And then, you know, how do you reach out and have that conversation? There's a couple of things. First of all, it's okay to have the conversation, and it's okay to ask with respect and kindness, and just really openly, and focus maybe on the behaviors. You know, I see that you're not the person I saw 3 months ago or a year ago. I see that, you know, you just don't seem to be as happy, or you don't seem to be enjoying the things as much, or I really see these particular changes. Tell me about that. You know, I've heard about, you can even say, look, I've heard about, you know, some resources. I know this is happening. Maybe you can offer them the numbers or the program and say, look, this might help, because, you know, I've heard on this program that I was just talking to, that it's really not okay. But when people are in really complex states of distress, it's really important to know that family members can also call and get the supports that they need. So it's really important to know that we're there for you too, because it is stressful. And sometimes you need support and navigation. And how do you make that referral? How do you encourage somebody? So, you know, that's where you can call and you can talk to a therapist or talk to somebody and say, how do I get, you know, with those more complex situations, how might I deal with it?
But you can't refer somebody. They have to always refer themselves in the end.
Well, you know, the only time you quote unquote refer somebody is if somebody's in crisis and the risk of harm to themselves or others. That's where we can have some intervention by police and have people, you know, because we think that they're at risk of harming themselves or others. But those are very acute, extreme cases. But if, you know, people are adults and they do have choice, but, you know, nobody wants to feel bad. So what we want to do is figure out and let them know that there is hope. It's always about there's hope. And let's be bearers of hope.
Mm-hmm. Now, let's come back and talk about the Canadian Mental Health Association, York Region, for a moment. As well as a staff that provides services, you also recruit volunteers for the association. And I want to ask you about the volunteer opportunities that exist, and where are your needs in this area?
So, you know, what I really want to say to people, and I know we only have a few minutes left, is that when we talk about our community, what does a healthy community look like? It's one where we're inclusive and that we all understand that mental health affects us all, but how we can make a difference to make the road a little less hard for the person coming behind. If any of us have been there, and I've been there, knowing that I could do something to make it a little easier for the next person and contributing and donating. So I want to talk about one particular event that we have coming up, and it's in June. It's called Mental Health in Motion. Mental Health in Motion, you can register for free, but it's really, and you could run, walk, bike. We talked about the amazing trails. Get out there and do something and raise some money. And all that money is going to go to our youth and other mental health programs, specifically to provide access to those that are really struggling at this time. It's a great way to get involved in your home community that fits in with the stay-at-home orders where you can get out there, but you can also make a huge difference and be part of the conversation. We have great volunteer opportunities, and we welcome you to call our organization, and those numbers can flash up again and ask. But however, I think that there's so many ways that you can be an advocate for mental health. All of us have been there, and particularly those that have been there know that when you've seen somebody make a difference, it helps you so much and you want to give back. So, people have helped me, people have helped other people that I know, and that help has been so meaningful. And that life of gratitude is, how can I give back and be generous to the next person? And the easiest thing that people can do today is sign up for Mental Health in Motion. Join me. I'm going to ride, not in one day, but I'm going to ride over that week. I'm going to set myself a goal of riding over 100 kilometers on my bicycle for Mental Health in Motion, and raise money so that I can support our community, particularly the youth in our community, to access the resources, because they're really struggling, those kids right now. So I want to make a difference for them.
I just want to get Mental Health in Motion. And how does someone sign up for it?
Just go to our website, Mental Health in Motion. So It's great. They can go to the CMHA York Region, or they can just Google Mental Health in Motion. It's ever easiest for people. It's an amazing opportunity. And hopefully, this year, of course, it's got to be virtual, but next year, hopefully we can have a live event and all come together again to show our support.
But I can't virtually ride my bicycle, can I?
No, you can, but you can ride at home and virtually ride. You can, because I'm not going to check. I won't tell.
I could put a screen on the computer here and pretend that I'm cycling along. No, I wouldn't do that. Again, one last thing. I do think we should just talk about youth, because that's one area we haven't actually, in 30 seconds left. If a youth is experiencing a point of crisis right now, and we did take a look at some of the data, talked about more inclination, more thoughts of suicide, how can a youth reach out for assistance if they need it now?
Absolutely. You know what? They need to call. We have our MOBIES program still. So MOBIES, they can look that up. Now, MOBIES is anonymous. So for youth who are worried, go to MOBIES. We've got a comprehensive program just for you. And I know we have to stop now, but we'll come back and talk about more later. Thanks.
Okay. Listen, Rebecca, thank you very, very much for coming on the show. I know this is a particularly busy time for you. Do appreciate it. And we would like to wish everyone good mental health this week and in the future. This has been Politically Speaking. I'm Dave Szollosy.